Hey guys, welcome to the show, 888-659-3727. Great to be here. I'm Spencer Kobren, and you are listening to and watching The Bald Truth. This is The Bald Show, self-help radio for guys, and of course for girls who get it. Let me fix my mic here. Everything's way off. This is what we do. If you're tuning in, this is the first time that you've ever seen this broadcast. It could be odd, because we do a bald show. Now, we're not here to sell you anything. I'm not here to guide you in a direction that's going to be unsafe. I am a consumer advocate for men and women dealing with hair loss. I'm the author of a couple of very well-known books on the subject of the prevention and treatment of hair loss. So well-known, in fact, that my first book has been in publication since 1998 in a couple of different editions, and has been published in 5 languages. The name of that book is The Bald Truth, same as the name of the broadcast. And what we try to do here is provide a safe place, a platform for men and women who are dealing with hair loss to talk about a subject that society just does not allow us to deal with in everyday life. They don't allow us to deal with it. Why? I don't know. It's like the last bastion of political incorrectness. That's why. For some reason, we are allowed to, now as men, we can talk about our feelings, which is great. Nothing wrong with that. We should be able to talk about our feelings. We can talk about our feelings when it comes to everything except how hair loss makes us feel about ourselves, how we might feel less attractive, how the world views us as hair loss sufferers. I talk about these experiences that I have all the time in my everyday life. I talked about what went down last New Year's Eve, this New Year's Eve, at the New Year's Eve party, just how insensitive people can be. I had another similar incident, which it wasn't directed towards me, but I was at a deli this week. A new deli opened up in the neighborhood. I decided to order some food and pick it up. And I overheard a woman. It sounded like it might have been this guy's wife or girlfriend or fiance, or, I didn't look for any rings on their fingers, but they sounded like they've been together for a long time. And I'm not going to get into the entire story, but what I will say is this. This woman was basically telling this guy that he needs to change his hairstyle. And I'm looking at the guy, and I see what he's trying to do. He's pulling the old Shambui. He's trying to pull a cover up. He's doing like a Caesar thing. And she was basically saying that it's old. She doesn't like the way it looks anymore. And he didn't know how to react. I mean, I'm assuming they were close, but he still didn't know how to react to it. Now, it wasn't a very loud conversation, so I was, eavesdropping for sure. But as soon as I hear a conversation like that, my ears perk up. But I looked at this poor guy, and to me, he wasn't even able to express why he chooses to wear his hair the way that he does to this woman. Probably out of fear that she would never understand. Or he doesn't want to admit that he feels, uncomfortable about it. Now, it's wild to me that a woman would actually try to, either like the guy or you don't. You want to be with the guy or you don't. But to have a conversation at a restaurant about his hairstyle, to me, it's unbelievable. But nothing is unbelievable when it comes to, in my view, when it comes to the way women treat guys and their hair. Unless a woman is dealing with hair loss herself, she can never, ever understand why we do what we do, why we feel the way that we feel about our hair loss, why we will do everything possible, especially if you're a person like me, to try to save the hair that we have on our heads. And just how uncomfortable people like this woman can make somebody feel. Imagine, and again, I use this analogy all the time. And this woman had a big fat ass. She looked like she hadn't been in the gym in 10 years. Imagine if her husband started to have that conversation about her or her boyfriend in the restaurant about the size of her ass, something that she could do something about in most cases. And this was not this was a younger woman. She was probably about 27 years old, maybe 30 years old. A complete slob. I can't even imagine what she must look like with her clothes off. Like, you have to look at her with, like, through a piece of paper with a little pinhole through it. It's got to be a complete mess under there. You can't make this shit up. When I hear these things, when I listen to the way people treat each other, it blows my mind. 888-659-3727. Listen, guys, we want to. I'm gonna definitely take your calls, but I wanted to bring our old friend of the program, the original hair transplant mentor, Joe Tillman, on the show. I have him Skyped in through my other computer. Let's see if we can pot him up and say hi to Joe. Hey, Joe, you there, man?
I sure am.
Oh, dude, you sound great.
Awesome. Good. It worked.
It does. It's working.
Yay.
It's working. So, listen, I mean, you can't make this shit up. And I had to tell the story. And it just, when I hear things like this, it's just, I can't believe. First of all, I feel so fortunate that I have the woman that I have in my life. But you hear stories like this all the time. And this is why people come onto the message forum and they're so, obsessed and so uncomfortable in their own skin, and they're trying to do whatever they can do to try to help themselves. Listen, we talk about confidence and the importance of feeling comfortable in your own skin, but the truth is there are fucked up people like this woman out there, and I think it's really difficult, especially for the younger guys, to deal with.
Well, look, I mean, I was listening to what you were saying before you potted me up, and I was thinking to myself, what did this woman look like before you got to her her visible issues?
That's a good point, actually.
And that just confirmed what was going through my head. Is like, well, what is it about herself that she hates to where she feels she needs to attack the comfort zone that she's in with this guy, right?
I've got to tell you, as far as the couple is concerned, the guy, in my view, was much better looking than the woman. The woman looked like she had plenty of hair, dude, but she was a mess.
It's obvious.
Yeah,
it's obvious. He's okay. So you laid it out. She has this giant ass, and he's a good looking guy. That's assuming that all things being equal, as far as proportions go, that he'd still be a much better looking person than she would. So it's obvious to me that she's just trying to put him down to keep him on the same level as her. The
guy could have a complete horseshoe. He could be rocking the horseshoe, and he would have been better looking. Yeah, and I'm not just saying that because, because this woman was so nasty. It's just the reality of the situation. But, you're right. This is what's interesting. I do notice that less attractive women seem to be the most critical. Guys think it's the hot chicks. But when you really go out into the street, you go into the malls, you go into the restaurants, the hottest women are usually with guys. I mean, they seem like they got their shit together, but they're not necessarily with, GQ models. Right. They're with the regular dudes who probably have figured out a way to make it in life.
Well, it's like this. We've talked about this many times over the years, where you don't necessarily have to have a full head of hair. You don't necessarily have to have, this or that. As long as the guy's got confidence and can carry himself like he knows what he's talking about, and he doesn't really have any sort of issues with himself. Even if there are issues that are obvious, like hair loss, for instance, he can pull some pretty serious talent that would normally be considered above his pay grade, if you know what I mean.
Well, it's interesting because this reminds me that there's some studies that have been done over the years about people's IQs, and basically there is a threshold. Average IQ is about 100, that freaks me out that it's that low. But if a person has, say, up to 120, 125 IQ, they're considered extremely intelligent. And once you get past a certain threshold, those extra IQ points don't necessarily mean that you do better in life. And on average, it seems that the people who have kind of higher than average IQs do better in life, both financially and socially, interpersonally, than people with extremely high IQs. So, basically the analogy I'm trying to make is you basically just have to be good enough to make it big in this world, no matter what you're doing in life. And that means with women, as long as you're good looking enough, don't have to be, Brad Pitt. As as long as you take care of yourself, you're good looking enough, as long as you have the confidence, and as long as you can figure out a way to make your way in this world and be, successful. You don't have to be a multimillionaire, but you have to have something under your belt.
Something stable, something where, yeah.
I mean, if you're good enough, you can get what you want in this world. And guys, and I notice the young guys, especially on the message forum, they don't get that. They think they have to be millionaires. They think they have to look like Brad Pitt. They think they have to be these, perfect 8s to 10s. I see these guys who write these numbers. It's ludicrous. It's not like that. We're men. I hate to say it. There is a difference.
Well, look, I mean, it's easy to figure out why. It's because the media is influencing what we think. And this is an age-old argument, but they're influencing what we think is ideal, right? Not just for men, but for women. The Barbie doll complex, and of course the Ken doll, not the hair reference, but the Ken doll complex, where you got to have these perfect features. That's why we got guys that are I see online,
they're suicidal because they don't have like square chins.
No, I'm talking about the guys that actually go and get those square chins, the guys that go get the pec implants, the guys that get the not just the hair transplant, but the rhinoplasty, the chins, right, the cheekbones, the pecs, there's an article on was it the Independent or one of those UK online papers or news sources where had this guy spent 125,000 pounds on turning himself into his ideal man.
Oh yeah, I've seen those. Yeah,
and it's fairly common, and where you see this, and it just blows my mind. But the way that he's sculpting himself, for lack of a better, is in the vein of like a Ken doll, with the perfect features, and it's things like this that represent to me how media and society have sculpted, for lack of a better word, what we're supposed to think of ourselves, and I think yeah, it has molded what we think is attractive, and I understand that, and I think that there's some credit to be given for helping to push the idea of fitness and being slim, and not so much slim, but being healthy.
Right.
But there are some extremes that I think have just gone too far, which in obvious situations. So
well, if I'm going to be frank, and I usually am pretty candid, I still think there still is a huge difference when it comes to men and women. Even though we are being more shamed into. There's more body shaming, so to speak, coming over to the male side of things, and guys are they're made to feel less secure if they don't have abs, and if they don't have tans, and they don't have huge dicks, and all this stuff. I mean, it's really getting to the point where I think guys are losing their minds. But the truth is, it still pales in comparison to what women go through the media. And I have to say, I'm still a believer of this, and maybe because I'm an older guy, but good enough as far as getting the hottest woman in the room. As long as you're good enough, as long as you're someone who you will not embarrass her in front of her friends and family as far as your looks, then you're fine. You do not have to be an actor or a model to get great chicks, and you do not have to have a full head of hair, no matter what these guys think.
What I learned early on, and I didn't realize I'd learned this. It's not like I was sitting down saying to myself, wow, this is the ticket. But what I kind of fell into, and I've talked about this before, where after I had my first 2 surgeries in the early 90s and I had the pluggy hairline, my opinion is that guys that go through that do one of 2 things. They either retreat into a hermit-like existence, wearing ball caps, not going out with their friends, and kind of being in a dark space, or they turn it around and go the opposite extreme,
right,
having outgoing personality plus, being the funny guy, in a way maybe to distract from the situation. That's what I did. I wound up, sticking to positions where I was like a bartender, or, I was in the service industry, restaurant service industry for several years, and so I developed this routine, this shield, as it were, to deflect from what I knew to be an obvious deficiency in my appearance, which was my hair and my hairline specifically. And
but you're also when you bartend, and when you put yourself in a position like that, you're actually putting yourself in a position of power. You're in the hierarchy when it comes.
You
to
are
chicks.
the man when you're a bar. Well, and that's what I was getting to is when you're in that position, you are the man. You are the the bottle tosser, the guy with the jokes, the guy with the guy with the power. And
so in that world, the
that.
younger girls absolutely are attracted to that power. You're able to get them drinks. They're recognized when they come to the bar. They're able to say, "I know the bartender," and you are in that power position. And
absolutely.
It's funny, you know, guys are always like, they don't understand why bartenders, I'm talking about, you know, guys who are making, you know, maybe they're making $50,000, $60,000 a year, and that's not a bad living, but why bartenders are able to pull so many women, hot women. And a lot of these guys, they're slobs.
Absolutely.
You know, it's all about power. It's all about perceived power. It's all about the way that you kind of fit into your own role, into your own skin. And I think, a lot of guys just don't get that, man.
And let me tell you one more thing. When you're in the restaurant business, it's if you don't have at least an average personality, if you're not getting laid in restaurants and bars, I mean, if there are good-looking women, good-looking guys, it just happens. There's a lot of action going on.
Yeah. Oh, yeah.
And if you don't get any sort of action in a restaurant you work in, there's something wrong.
Yeah, when I was young, when I was 18, 19 years old, like, you know, when I was in college, my 1.5 years and my 3 semesters, I worked in a nightclub. And it was like, it was easy pickings. It was, if you were in that position, if you can get people through the door, if you could, you know, help them, you know, get drinks or whatever it was, which is, you know, the position that I was in, I mean, the women would just line up.
Sorry, what's that music coming from?
You hear music?
Yeah.
I don't know. Let's see. Is it loud?
No, it just ended. No, now I hear it again. Oh, you know. Oh, I know what's going on. It's this. I got GFQ Network potted up. And
they're trying to make money again.
Yeah. Who do they think they are?
All right, I'll tell you what. I know that you have some stuff to talk about. Let's go to the phones first, and let's see what people want to talk about, and then we can just kind of like free ball it. 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this? Where are you calling from?
Hi, this is Sam from Kansas City.
Hey, Sam from Kansas City. How are you?
I'm doing well. How are you doing?
Not bad, man. What's up? What can I do for you?
Hey. Well, I hate to shift the conversation a little bit about the same old stuff, but
listen, that's it's the hair loss show, man. It's fine. Don't worry about it.
Right.
Whatever you want to talk about.
Well, it's about Finasteride. You know, I've called the show a couple of times already. You know, about my experience going on it. You know, I had side effects the first time I took the pill.
So you're the guy who had the numb dick the first time you took it, and then you went back on it.
That's right.
Okay.
Yeah, and I thought I was doing fine. You know, I talked about, you know, some vision problems that I've had, but I wasn't too concerned about it. But the day after, and ever since then, like literally the day after, you know, I started getting these sharp but fleeting chest pains, and I got pains in my sternum and in my abdomen. And you know, I was concerned about that. I was taking a full dose, so I went back to a half dose, which I had been doing previously. And then the vision problems still kept happening. And I called my doctor, and, you know, I was able to get a hold of the nurse, and the nurse told me to stop taking it altogether. And I did that. But these side effects, unfortunately, I mean, I think they're a little less extreme, but you know, after like a week and a half of getting off of it, for some reason I'm still having these side effects, like as if I'm still taking the medication. Like just yesterday, I had this weird vision thing where like I couldn't really watch what was on TV, and I couldn't really see anything out of my peripheral vision. It was really weird.
Well, first of all, and I'm not going to lie, those are scary side effects. Now, if they are related to finasteride, then shit, you know, I mean, I think getting off the drug obviously was the best thing for you. I've been doing this for a long time, and you did bring up the halo thing that you were seeing when you were driving at night. I have heard some guys, at least anecdotally, complain of some haloing. Usually seem to be transient. I don't know if you've heard of that, Joe.
I don't recall hearing any sort of vision issues. I may have, but I mean, it's after 12 years, you kind of, lose sight of some of the things you've heard. But
Sure.
I don't recall hearing this. Not to discount what the caller was going through. I just don't recall hearing anything like this. Now, as far as the chest pains, things like that, I might have heard one or two people in the past talk about that, but I can't say anything about the vision. I wish I had more on that one.
Yeah, and the thing about the chest pains is this is what's odd to me. I don't see why, if in fact, and again, I mean, I obviously this is happening to you. I mean, was your doctor able to explain why they may be continuing to happen? Did he bring in the fact that there may be some anxiety or some panic involved? I'm not talking about while you're on it. I'm talking about afterwards, after you stopped using it.
I don't think so. I mean, they just kind of hit me when I least expect it, when I'm doing anything, usually like when I'm watching TV or something.
Yeah.
I notice like when I'm running, I can, like, if I'll feel a little chest pain, if I'm like running, then like that chest pain that gets like worse. Like I feel the full extent of where the pain is. Well, I didn't really. Beforehand, it was mainly the vision that was concerning me. The chest pain I thought was minor and fleeting enough to where I could brush it off. That was probably irresponsible on my part, but the vision was my primary concern.
Yeah.
So all you heard about was the vision right now, and I'm bombarding my. I've called my doctor like 2 or 3 times up this road already, and.
But you know what? That's what he's there for. If he thinks you're a hypochondriac, then that's his problem. I mean, you have a physician for a reason. They're there to help you. And if he's a decent guy, he's going to pick up the phone. He's going to take your call. So I think to at the very least, to allay your fears, you should speak to the guy. You might want to get checked out. You might want to get an EKG, and just make sure everything is ticking properly.
What's an EKG?
The electrocardiogram.
Electrocardiogram, yeah.
Yeah.
Okay.
Should also check out your blood pressure, because
right.
this is these sound like symptoms of high blood pressure.
Yeah, that's actually a good suggestion, and it's possible. I mean, did you ever suffer from GERD or indigestion or anything like that in your life?
I mean, not to any extent that I know of.
Because it is possible, believe it or not, that the fillers in the drug could cause similar side effects to GERD or indigestion, and that's something you can talk to your doctor about.
That's interesting, actually, because I did feel like there was more indigestion and weird stuff happening. Like I hate saying these things because I feel like I'm like a guy on Propecia Health, with all of these symptoms.
Yeah, but you're having the problems, dude. That's what the show's about.
If you're having them, you're having them.
Yeah, that's what we're here for.
I just hate sounding like a hypochondriac. But.
Well, I appreciate the fact that I appreciate you saying that, but I just want you to know that, if we can help you out, that's what we're here for. So don't be concerned about that.
All right, thank you. But yeah, you're right. I did feel this weird churning in my, I heard a weird churning in my stomach, like when I was taking the drug.
Yeah, well, I will say that there are people who, and it's not just with this drug, it's with generics and brand name, different drugs that have different fillers. Some people just cannot tolerate the fillers in drugs. And again, I'm not a physician, so it's possible that you were suffering with some form of indigestion. Sometimes I've had indigestion or GERD where it feels like you're having a heart attack. I mean, it's that painful. So, it's definitely something you should check out for sure. Now, were you using?
It affects your chest area?
Oh yeah, absolutely. Yeah. It affects your chest area. Oh my God, it's the worst pain in the world. It feels like you're being stabbed in the chest with a knife.
That actually sounds.
Kind of what it feels like.
It also sounds like pleurisy, if you know what that is, where you get gas bubbles in between the the lining around your lungs, and like you said, it sounds like an ice pick going through your chest.
Yeah.
Or feels like it, and I've had that off and on through my life. It scares the hell out of you. But then once I realized what it was, it's like, okay, control my breathing, slow down. All right, we're good. And it goes away.
Yeah. What you might want to do is if you do feel the pain again, there's a couple of things you can do. And again, I'm not a physician, so I'm not giving you medical advice, but this is what I would do until you get to your doctor. Get yourself some Tums or get yourself some Alka-Seltzer, chewable, heartburn. They're heartburn chewables. And if you feel any of this pain, take one. See what happens. If it dissipates, and it'll happen quickly, you'll know you're having indigestion.
Mm-hmm.
For sure.
So a heartburn pill or a Tum, you think?
Definitely, yeah.
Well, I mean,
I would take something that's
for a while.
Take something that's over the counter.
Like 2 weeks.
Take something that's over the counter, and take something. And again, I'm not a physician, so I'm not giving medical advice.
Right.
This is what I would do until I got to my doctor. If you're feeling this way, try it. You can get yourself some Tums or get yourself some Alka-Seltzer chewables for heartburn. And if it is GERD-related, heartburn-related, it should dissipate almost immediately after you start taking the antacid.
Yep.
Okay, that's. I'll definitely make note of that and try it. I was actually calling because I was really concerned. I thought that like this was like early onset like gyno or something, and then it was just breast enlargement. Is that what it's called?
Yeah, your gyno. First of all, gyno you would feel on the outside. You'd start feeling a tenderness, and I'm touching myself like I have breasts. You'd feel a tenderness on your nipples and maybe even a swelling, like a puffiness. You're not going to feel you're not going to feel chest pain. It's not going to be inside your chest. To me, it honestly sounds like you're suffering with pretty significant indigestion, but I'm not a doctor. You got to get your heart checked out. You got to get your blood pressure checked. But it seems, from what I understand, from what I remember, you're a young guy, and it's very possible that you're having problems just with the filler, and sometimes even just taking the medication differently could help. Even crushing it up, drinking it with water could help. So,
okay, I'll make note of that because those were 2 side effects I had on it, and it'd be good to know if those are from the fillers and not the actual Finasteride.
Hey, just curious. How long had you been taking the medication before you saw the problems and decided to quit?
Not very long. I started cutting up in half like this late December.
Okay.
So really not that long.
Okay. So it wasn't like 6 months or a year that you were taking it.
Oh no, less than a month.
Okay,
yeah.
Fair enough. The reason I'm asking is because I seem to notice a higher incidence of people saying they had a really positive experience, but also having the side effects. And so I was wondering if you've been on it for a while, did you see any sort of positive effects for the hair aside from the side effects? But you weren't on it long enough.
Well, he took it. He took it for one night. He had dick pain. His dick was numb. And
night?
The first night. And then he decided to go back on it, if I remember the story correctly, and correct me if I'm wrong, and you went on half of a milligram, and you said you had no side effects.
Wow.
Yeah, well, now that I look back, there was slight indigestion, but I wrote that off as, that's when the churning started, but I wrote that off as something not related to Finasteride, but maybe it was related to Finasteride.
It was probably, honestly, it may not be related to Finasteride. Like I said, it might just be related to the pill itself, to what's in the pill that's, the fillers.
Fillers, right.
And also the dyes. I mean, believe it or not, something as simple as just one filler could affect somebody's and, could give somebody indigestion. It's just a weird phenomenon that people don't think of right away. But it can happen. I'm surprised the nurse didn't say anything about that.
No, I've been really not getting that much information about the drug. Like when I've been calling, it seems like
it's frightening how little these doctors and nurses really know about it.
Yeah, was this a GP or a general practitioner or someone that specializes in hair?
It's just a general practitioner.
Oh yeah. It's rare that they have any sort of idea what what the medication does beyond what the literature in the box says. I mean, it's hard to find a GP that actually knows anything about the medication, much less the history of the medication. That's the same thing as Proscar and all kinds of issues that go along with it. Not that it's the fault of the doctor, because there's so many things that they got to know anyway, being a general practitioner. But obviously they're not a specialist, so they don't have as much experience with it as say a dermatologist or even a hair transplant doctor that specializes in hair.
But to me, I would take the time if I was this guy's doctor or nurse, and at least go to the PDR and look up all these possible side effects. And it's, and kind of, gauge whether or not and what type of device. Now, it's great. Yeah, just get off the medication. But not everybody wants to just get off the medication because he's taking it for a reason. He wants to try to save his hair. So, yeah, I would listen. I think obviously it was safe advice to get off the medication, but go get yourself some antacid. Talk to your doctor. Again, this is not medical advice, but this is what I would do for myself. See if that helps. If it helps, then what you're dealing with is heartburn or indigestion. But you still need, anytime you have chest pain, you need to get it checked out.
Agreed.
Yeah.
All right, man.
Okay.
All right.
All right. Thank you.
All right. I'm sorry that you're dealing with this, but keep us abreast of what happens.
I will definitely.
All right.
So,
yeah.
Can I ask you one quick question?
Yes, you can.
If it turns out it was just indigestion, and maybe it was like from the fillers or something, where do I go from there as far as taking the drug?
I would make sure that I take it with food.
Okay.
Not just pop the pill at night or in the daytime. Make sure that you take it with a meal, and see how you do. You could also crush the pill and take it with a meal. Sometimes that will help. When people are dealing with those types of side effects. But I think the most important advice is if you're concerned about chest pain, you got to go in and you got to check out your heart and you got to check out your blood pressure.
Okay. All right.
All right.
Thank you.
All right, man. Good luck.
All right.
Okay.
Yeah.
Take care.
Have a good night, guys.
All right.
Good night.
I hate, when I hear stuff like that, I feel so bad for these guys. And I know it's real. I know they're feeling this. And anytime you pop anything, I'm the same way. I really am. If I pop a pill or if I have to take, and I get a weird feeling, I automatically think that it's poison or that it's something that's obviously, you're not reacting well to it. So this guy wants to save his hair. He took it the first night he took it. He couldn't feel his dick, he said. So that's scary.
That is scary, and it kills me because I can't, like you, I don't like hearing these stories because these guys are they're taking this pill with a hope, with a desperate hope sometimes.
Yeah.
To save their hair because it's causing them so much emotional trauma and distress, and the one thing
that works
is screwing them up.
Yeah.
And then it comes down to, do you want to be able to bang chicks or do you want to have hair?
Absolutely.
You can't have them both. And I remember, sitting in the office doing consultations, and guys would tell me they'd be in that situation. It's just like, all I can do is shake my head and just say, I'm sorry.
That's a tough call. And he's right. He's like you said, he doesn't want to sound like the guys on Propecia Help. But if he's feeling this, if he's dealing with this, then where else should he go? This is the place to come.
Yeah. Yeah, and I'm glad he updated you or us on the situation. And it makes me think about my own situation. I'm actually nothing to do with hair, but I'm actually getting more and more concerned with my health. I actually submitted for my first full physical in like 10 years last week, doing the blood work, testosterone levels. I actually stopped taking my Finasteride for a couple of weeks to make sure it's out of my system so I can get a baseline PSA level.
Good for you.
Thank you.
Good for you. Yeah, I actually recently refused a PSA based on the advice of he's a well-known urologist who was the president of the American Cancer Society, who I spoke with personally. And now, for some reason, I forget his name, but I had him on the show a long time ago. And he was saying there's just too many false positives, and too many people are being treated based on false positives with PSAs. And now, if you go to the American Cancer Society, the recommendation is to kind of like, weigh your options. This may not be the best route. So I don't know. I had one done 2 years ago. And basically he just doubled my, number. And that's what they do when you're on Finasteride. And I was fine. But I don't know. It's tough. It's a tough call.
I considered doing that, just staying on it and then doubling my PSA number.
Yeah.
But I thought, you know what? I don't want to leave a test result at 45 years of age to an average formula. Right.
Well, but let's put it this way: if you're able to double it, and it's still under the threshold, you're in good shape.
No, that makes sense. It makes sense. I just wanted to do kind of a cleanse, and I no supplements for me, no vitamins, no nothing. I just wanted to go in au naturel, get my blood work done, see where my natural levels are.
I don't mean to cut you off, but I'm going to be turning 50 in 6 months, and I got to go for the tube, man. I'm going for the full Monty. I got to get the colonoscopy. That's a big one. I'm not looking forward to that, but you know what? I'm not going to avoid it.
No,
I got to do it.
What's strange is I'm actually. This is weird. I don't like going to the doctor because not because I'm afraid of doctors. Hell, I work with doctors for half my life, but it's just I never really thought about it being something that I need to do for myself. I've always, well, at least for the past few years anyway, I've been conscious about what I eat, and you see my transformation, the physical and the dietary, nutritional,
right.
all that stuff. But it's like I don't know. Over Christmas or right before Christmas, I was like, I'm going to be 46.
Yeah.
It's New Year's coming up, 2015. It's the year I turned 46. I'm on the back end of heading towards 50. No offense. And
that's all right.
And I thought it's time to take it to the next level. So,
dude, I am for me to be turning 50 is like I can't even believe it's happening. It's like it's not a bad thing. It's like I made it.
Yeah,
I made it. I feel I feel good. I'm still doing what I love to do. And this next decade, I believe, will probably be the most productive decade of my life.
Yeah.
But I could die tomorrow too. So that's how I live my life. Whatever it is, I'll get the tube done. Let's see what's going on up there.
Yeah.
And that's it. I've been on Finasteride for over 20 years. Who knows? I can drop dead from it tomorrow. That's how I think about it.
If you do, then I'll know to stop.
Yeah, that exactly. There's, you know what? I'll call you guys. I'll let you guys know. You know what? I have some bizarre thing happening. Could be from the Finasteride. Sorry.
And if you don't show up the next week on air, and Andrew comes on your place with a sobering message, I'm sorry. That's kind of morbid.
Yeah. You know what, dude? I look at life as one day at a time. At the end of the day, when I go to bed, and I brush my teeth, and I'm watching the news. I'm like, you know what? I conquered the day. I made it. I beat the day.
I do the same thing, but only because I don't have enough intelligence to have the foresight for next week, much less next year. No, just kidding. But I feel good because I'm actually anxious to see what my blood test results say. I was really happy with my blood pressure reading. It was 114/69.
That's beautiful.
And yeah, it was beautiful. I mean, the doctor is like, "You're 45?" I'm like, "Yeah." He goes, "Good on you, man. Good on you." So, a good start to this this review of where my health is right now. So pretty happy about that.
No, listen, health is the most important thing, man. But like I said, I live one day at a time, and it's true. Every day, every work day, everything that I do, I get up, I work my balls off. And then, even common law is like, "Why do you work so hard?" I'm like, "Well, this is what I do. What else am I going to do?"
Yeah.
I got to work hard. I got to make sure that we have a great future. And, yes, I know I could die tomorrow, but I enjoy what I do. This is what I do. And if I don't wake up tomorrow, when you give my eulogy, be like, "That was the hardest working motherfucker I ever knew." That's not such a bad thing.
That's not a bad thing. It could be worse. It could be this is the fattest.
That's right.
most lazy.
That's right. And
mother effer.
A lot of guys like that.
Yeah, there are a lot of guys like that.
All right,
sure.
Let's take another phone call.
Okay.
And then we can talk about what we're going to talk about.
Right on.
Hey, man, you are on the air. Who's this, and where are you calling from? Hey, man.
Hello?
Yes. Hello.
Thank you. I wasn't sure if I had dialed in because I was listening. It's a little bit of a delay, so I'm glad that I finally caught.
You're on. What can I do for you? What's your name and where are you calling from?
My name's Margaret. I'm calling from New Jersey.
Welcome, Margaret. What can I do for you?
Well, I'm not sure how I should introduce this, but I do want to say that by a fluke accident, I had made a soap that helped to clear up people's skin, and we found that it's actually helping people to grow their hair back. And I didn't know why it was working, and so I had to sit down and I had to reverse engineer it, and I had to do a tremendous amount of research. And so I finally figured out why it was working. I haven't had the time to buy your books yet, and this is the first time I'm listening to your show. That was highly recommended to me a few times by a few different people saying, you have to listen.
Okay.
I want to share it with you. I don't know how to do it. I don't want to.
Well, I'll tell you what. This is, you have to understand. You're speaking to two of the most skeptical guys out there because we've been in the business for so long. But with that said, I'd be more than happy to hear what you have to say. And if you're saying that you have developed some sort of a soap that's helping people with their hair, I'll listen. So tell us about it.
All right. Well, I'll tell you when I reverse engineered it, why I think it is working. The research that I did shows that there's a drug out there that will turn off the immune system. And when it turns off the immune system, it's a drug they're using for arthritis, for rheumatoid arthritis. And when people take that, their hair grows back. And so the problem with that is that you can't just turn off somebody's immune system for a time. They also know that one of the tetracycline drugs, one of the cyclines, when men or women take that, it also helps their hair to grow back. So
now so just to let you know, I mean, when you're dealing with autoimmune hair loss, you're talking about something that's known as alopecia areata, which concerns alopecia universalis or totalis, total hair loss of the body. There are different mechanisms that basically, it is thought to be an autoimmune response, and that's why these arthritis drugs, these drugs that are basically shutting down those immune responses, are helping people grow back their hair. So it's a different mechanism than male and female pattern hair loss.
But I just want to let you know, I'm just a researcher. That's what I do. I have a farm. I make natural things for my family, for friends. But I'm an avid researcher.
Right.
And I want to see what I found and how I've put the pieces together, because I think I've put them together in a way that makes a lot of sense, and it seems to be proof positive. So I'm going to lay out why I think my product is working.
Sure.
I think the product's working because another version of the soap that I make for animals will clear up mange. And it will clear up funguses and mange in horses. It will clear up, mange in animals. And so it's really just a parasite. So the version of the soap, and for people who are using it, I think what it's doing is it's actually killing the parasite that's actually eating the hair follicles to get at the hormone. So either it's trying to get at the DHT or it's trying to get at the cortisol. But I do want to mention a couple of things. In 1992, there was a study done by a woman doctor who actually took 47 people with alopecia, and she treated them with 4 different essential oils that she rubbed into their scalp twice a day. And in 3 months, they all had full hair growth back. And that was done in a double-blind study.
Right, and that was done on patients with alopecia areata.
Right.
Yeah. I'm familiar with the study, and I'm actually familiar with all that information. That's all. When I wrote The Bald Truth in 1998, I actually wrote about that. And I wrote about essential oils and the possibility of them helping with hair loss. Also, I wrote an entire herbal chapter on herbal supplementation and hair loss, which since I've been doing this for 17 years, I've kind of reversed my stance on that, because at least when it comes to androgenetic alopecia, herbal supplementation herbal supplements like Pygeum africanum and stinging nettle, all stuff that has been shown to lower DHT, does not seem to help with common androgenetic alopecia.
That's because the concentrations of anti-DHT mechanisms is so little compared to something like a Propecia or
that's right, and
like that. It just has no effect.
That's right, and also it's really difficult to regulate, and you don't know exactly what the dosage is,
of course,
and what the safe dosage is. And just because it comes from nature, it still comes from nature's pharmacy. These herbal supplements and these essential oils and all these products do have the potential for side effects as well. So it's important that people know that. But I'm open to anything. If you're telling me that you've been able to help people, I want to hear it.
All right. Well, good. I just wanted to continue a little further to explain why I feel that it's working and how the information I shared previously ties into this.
Sure.
What I do believe is that there is an organism that's coming, it attacks the hair follicle, chews it down because it really just wants to get to the hormone, to the scalp itself. And the body's own defense mechanism kicks in. And as part of the immune system, what the body will do is create extra sebum, create the extra wax to fill in the follicle until conditions are better so that the hair follicle can come out and grow safely again. And so the body's waiting for the human to figure it out. And the human doesn't figure out that it's being attacked by a parasite. And so so it just makes additional wax. And that's why, like, really bald guys have very shiny heads. It's because they do have extra sebum on their scalp.
Joe, I'm going to let you respond to this.
With all due respect to the caller, this represents why the majority of people that are suffering hair loss or have any sort of interest in hair loss have no idea how to properly treat it. And the reason being is, as the caller is saying, these parasites and these bugs, as it were, attacking the hair follicle, chewing it down to get to the hormones.
Well, first of all, the only bugs that were ever basically associated with hair follicles were Demodox follicularium. And yeah, I mean, there is some connection to rosacea and inflammatory effects, of the scalp.
Yeah.
But nothing to do with hair loss.
It has nothing to do with male patterned hair loss,
right,
as we discuss on this show and online. But what the caller is representing is a vast number of people in North America and the world that think that that the situation that's causing hair loss in people she's working with is the root cause of all hair loss for men and women that would otherwise be treated with Propecia and Proscar. And go ahead.
Go ahead.
I know Spencer's name. I don't know. What is your name?
My name's Joe.
No, I'm sorry. No, I understand that there's all different reasons for hair loss. There's many different reasons for hair loss. The people that I feel that my product is working for are the people who are under they have high stress in their lives, and they are producing more cortisol or they're producing more DHT. Mm-hmm. And I do believe that what this soap is doing is it's actually helping to keep the parasites at bay, and it's helping to create an environment where the hair can grow up and out. And this is who the product's working for. It's working for women. It works for men very quickly, young men who are just starting to lose their hair. It comes back very quickly. Within 2 weeks, you can see a lot of hair growth coming back. And for women, within just a month's time, you'll see a lot of hair come back. There's a lady who it's both of these women that are in their 40s. It's hereditary for their mothers, their grandmothers. They all have it, where they really start to lose on the top big. And the woman started using the product, and I'm telling you, within 3 months' time, she had the shape of a heart that started at the base of her, the small part towards the base of the top of her head, that went all the way to the back by the crown where the heart shape was. And that is completely filling in by now. It's not real long hair, but it's long hair. I mean, it's about the size of your pinky.
Look, there's no doubt. I believe that just about anything on some people will help them grow hair, whether there's a placebo effect or whether it's reality. Even with what sounds like common androgenic alopecia, because what you described in that woman was, typical Ludwig scale of maybe Ludwig 2, where she's widening of the part and it's going all the way down the back, kind of like, splitting in on the back of the scalp. It's a very common way for women to lose their hair. So, look, it's difficult for us because, look, I've been doing this for almost 20 years. Joe's been in the industry for over a decade. How long now, Joe?
12 years solid. Yeah.
We've heard everything. And so many people have contacted me over the years. And I'm not saying that you're doing this, but so many people have contacted me over the years trying to sell some lotion or potion, telling me about stuff that they concocted, telling me. So it's difficult for us to we just try to be as respectful as possible, because I certainly believe that you believe what you're saying. And you know what? Who am I to say that the people that you are working with aren't being helped? But from all of the vast research that we've done and all the information I have as an industry insider, I can tell you that none of these lotions, potions, soaps, any of these theories, similar theories to what you're discussing, have ever proven to work on a consistent basis.
And that's the key, is consistency. It can work, from this guy over here and maybe someone else down the street, but everyone in between those two people, probably not. So that's what we look for as far as something that can validate the efficacy of a product, is consistency.
But what you might want to do is this. You might want to find a local physician. Where are you calling from again?
I'm from New Jersey.
Okay, you might want to find a local physician in New Jersey who treats, a dermatologist who treats patients with hair loss, and see if they're willing to, to try out your product on some patients. Maybe you can provide, the product free of charge, and see if you can maybe work on some sort of a small isolated study that, if it does work, that might eventually grow throughout the community.
I don't know. I've been involved with the forums a bit more lately. Part of it had to do with being on holiday, which was a great holiday, by the way. Went down to Northern California and spent some time taking photos and all that good stuff. But there's some crazy. I want to say, I won't throw a 4-letter word out there, but I'm trying to keep it clean. But there's just some crazy stuff going on. We know it happens, but when you hear about it, it still just makes you shake your head. There's a guy on Bald Truth Talk asking for input, asking for advice about what a doctor had told him during a consultation. And what he said was that he was told by this doctor that if he were to get if he were to get a hair transplant, it would actually prevent future hair loss.
Oh my God. Oh my God. You're kidding me.
I kid you not. And what he was talking about, let me see if I can find this.
Christ,
It just kills me. Does
this guy have like a neograph? Is he?
Exactly. Yeah, that's the first thing. Great minds think alike.
He must have a neograph.
That's exactly what I was thinking. He's probably a neograph guy. And so the
I want to make this clear for neograph guys and for the guys that are part of the IHRS that utilize the neograph. Listen, you know how I feel about it. There's a handful of guys who know how to use the neograph. They've jerry-rigged it. It's not right out of the box. They're real hair transplant surgeons who just decide to use this as a tool. To use this, they like the way that it, the handheld device. They like the way that the neograph operates as far as scoring the hair follicles. That's great. But most guys, unfortunately, that have neographs are novices in this field. That's all I'm saying.
Well, I actually went to the guy's website, the doctor's website, and he supposedly has 10 years of experience in the industry. Never heard of the guy, shocker. But
yeah.
Anyway, so this is the paraphrasing that the poster says was told to him by the doctor. He says, quote by the doctor, basically you need to understand that the hair loss is because of reduced blood supply secondary to the DHT effect. When we do a hair transplant, angiogenesis growth factors make new blood vessels, and as they are formed by the hair from the permanent zone in the back, the English isn't 100% correct here, but he's basically saying that the blood vessels in the back of the scalp are permanent, and so the hair itself helps for permanent blood vessels to form. And so when the transplanted hair from the donor zone is put into the front, it supplies new blood vessels to encourage new hair growth or to encourage a healthier scalp. And so he's saying that because of all the incisions made into the scalp, that the existing native hair, peripheral hairs, if you will not only not fall out, but can become stronger.
That is a interesting hocus pocus theory. It seems like it's kind of one of the theories that you might hear from some guys that might be pandering on message forums. Now, this guy on the message forum, he's not on our message forum, is he? Or this was from a patient who spoke to a doctor?
This is from a poster on Bald Truth Talk.
Yeah. But the doctor, there wasn't a doctor on Bald Truth Talk that wrote about this.
No.
Okay.
This was paraphrasing by the patient from what the doctor told him. The patient says,
Jesus.
or the poster says, "This is what the doctor told me."
All right. So did you respond to that?
I did.
Okay.
Oh boy, did I ever!
Okay. Good. Good.
Do you want me to read it? Or?
Yeah. Sure.
Yeah. Okay. Yeah. So what I said was, first off, I had to ask, who told you this? I said, when a hair is transplanted to the recipient zone, new blood vessels do indeed form, but this is in response to the trauma of having existing blood vessels compromised by the surgery. Blood supply is, to a degree, being rerouted. The scalp is one of the most vascular areas of the body, so blood supply is a non-issue. So whether new vessels are created or not is irrelevant. They can be from the trauma of the surgery, but it's not necessary for the continued growth of existing hair.
Right.
Or to make existing hair even more healthy. So what I said was, to answer your question, the answer is no. Hair transplant surgery does not prevent future hair loss. In many cases, not only does hair transplant surgery not prevent further hair loss, it can in fact expedite additional hair loss due to follicular transection and overwhelming trauma for vellus hairs. That is why if you do a search, you will find numerous examples of patients complaining of needing more hair surgery due to continued loss or permanent shock loss.
Yeah, very, very good, lucid, reasonable response. Did the guy respond back to you?
He did. He said he gave me his name, and should I out this guy?
No, don't add him.
Okay. Oh, come on, come on. Anyway, he works at beep, blah, 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 and he was going to be doing a neograft FUE hair transplant. If I did go through them, I should mention I'm already on Finasteride. Smart guy.
Yeah.
In response to Joe Tillman, are there any other questions I should ask my surgeon? Is there a way to determine if I would suffer shock or trauma from the transplant, as I would really hate to go through such an expensive surgery just to end up losing more hair?
Well, let me just state this. I recently, and I say this all the time, I recently spoke to a board-certified plastic surgeon who's like one of the greatest guys here in Los Angeles. I like him a lot. He's gotten a hold of a neograft, and I asked him some very specific questions about how he's using it in his practice. And all I can tell you is that my advice after speaking with him was to go get some training, and I advised him to train with someone specific. Otherwise, you're going to destroy your practice. And this plastic surgeon has taken my advice. Now, he explained to me the way the device was sold, and the fact that it was basically sold turnkey, and that techs would, basically the device comes with a connection to technicians who are able to do the entire procedure, and these doctors will learn on the job. Now, this is a very thorough guy, and he's a real plastic surgeon. So, I think he realized once he started to see what was happening that he wants to make sure that if he's going to offer this in his practice, that he does it right. Most people who end up purchasing one of these devices, they are not as ethical as this particular doctor. It's just, sadly, or at least in my view, like I don't know for sure, but in my view, they don't seem to be as ethical as a guy like this who's willing to put the brakes on, even though he paid a lot of money for this machine, and kind of start from scratch and learn from people who know what they're doing.
Well, that's refreshing to hear, but it's my question is it maybe not as ethical, or is it a mix of not as ethical and or perhaps not as informed?
Naive. You're right. You know what?
Yeah.
I'm glad you brought that up. It goes beyond ethics. It's about being naive.
Yeah.
These guys who are just getting into the field are told that hair transplantation is a very simple outpatient procedure. It's easy. If you are a plastic surgeon, there's no doubt that you can learn how to do this well. Look at all these urologists and these emergency medicine guys that are doing, hair transplantation. You're a trained surgeon.
Yeah.
So they sell them this machine, and then they sit there and they don't know what to do with it. They just they may have gone through a weekend course, but once they really get into it, they realize it is a much more difficult procedure than they could ever imagine it to be. So yeah, they may start with small numbers of grafts, do a 500 graft case or 1,000 graft case, and hope for the best. Hopefully their techs are good that day, but they're not always getting the same technicians. If the doctor himself does not know how to do every aspect of the surgery, at least to some degree, then they're setting themselves up and their patients up for huge problems. Now, I'm not saying that every doctor who's been, part of the IHRS are great at slivering or great at, cutting grafts under microscopes or great at, at placing grafts after they make the recipient sites. But they should have at least done it a couple of times. They should know what they're doing, and they should know how to lead their team.
Look, I think that if you're going to get into this industry and you're going to represent yourself, or you're going to represent a clinic, or, I'm talking not just the doctors, I'm talking consultants, I'm talking about people that have contact with the general public about what the service is that they perform or they offer or they represent, that they should know the procedure as much as possible from A to Z. And I say that as someone who, when I first got into the industry, being the traumatized, scarred up, butchered, insert adjective here, patient of having 2 failed surgeries. The moment I got into the industry professionally and walked into the clinic and started to learn about it, I actually told the docs, let me actually work as a tech as much as possible. Let me do as much as I'm allowed to legally do.
Right.
To learn about this procedure. I was on the microscopes. I was observing the grafts, and I was dissecting a few grafts here and there to learn how it's done, so that I can actually relate this part of the procedure, not just being a patient, but actually being part of the service to potential would-be patients of the clinic. And I think that for any doctor not to do that is selling themselves short, not to mention selling the patient short, because if they can't describe in detail from knowledge of how it's done, then...
Dude, are you kidding? Most docs, they don't know shit. I'm telling you, this guy is a really smart guy. And after I spoke to him, he was like, yeah, you know what? I'm willing to do whatever it takes, because, I want this to work out. And I want patients to be happy.
I like that. Good
and I did. And you know what? You have to understand, these guys make the investment. They usually want to get their investment back as soon as possible. He's willing to pull the reins on this and say, you know what? I'm not going to do any work right now. And I'm going to learn how to do every aspect of the surgery the way it's supposed to be done. And
that's how it's sold to them. Get your investment back in a matter of 10 surgeries, or, however many, based on however much they charge per graft.
Yeah, it's a mess out there.
It's sick. It is a mess. And
but look, I want to take a break. I don't know if you can hang out. If you want to hang out, you're welcome to hang out.
Sure.
for the rest of the show.
Yeah.
I'm gonna pot you down, put you on hold, guys. We are going to take a quick break. Let me give out the phone number: 888-659-3727. We are taking your calls about anything and everything hair loss. If you're considering surgery, if you are about to buy a product or service to treat your hair loss, if you read online that some guy in his basement wrote an ebook and has found the cure for hair loss, then then give us a call. 888-659-3727. I'm Spencer Kobren. You're listening to and watching The Bald Truth. Stay with us.
The man who's helping to make hair loss history.
They wish to cure us, but I say we are the cure.
It's Spencer David Kobren.
Hey guys, welcome back. Thank you so much for hanging out. 888-659-3727 is the toll-free number. If you're just tuning in, you are catching the tail end of The Bald Truth. Self-help radio for guys, and of course for girls who get it. I had a woman called in, gave her a lot of time on the show. She believes that she developed a soap that has helped many people with their hair loss. I hope that is the case. Unfortunately, though, there are so many products and services out there, so many people who believe that their products and services may be working. We have guys who have contacted the program who are convinced that, if you stop masturbating, your hair is going to grow back. I know you gave that a shot, Joe. Are you there, Joe Tillman?
Yeah, was that coming through?
Yeah, there you go.
Sorry.
Yeah. So, but we try our best to to obviously be cordial and to allow people to speak their minds. And I don't want people to get the wrong idea who tune into this program that we're here to talk about. The one thing that we try to avoid is talking about, giving any credence to possible snake oils, possible, lotions and potions that will not help you with your hair loss. But we are always open-minded to hearing what people have to say.
I would agree with that. I'm certainly open-minded to it, but I have to admit, there's a healthy dose of skepticism that jumps in my mind immediately when someone says, "I developed a new product."
Of course there is.
And
especially when they're talking about mites, and they're talking about sebum, and they're talking about
parasites.
all the stuff that we always hear about for so many years. But I will say, and I don't want this woman to be insulted. I do, so that's why I'm saying this. And it's true. I believe that she's sincere. I really do. I believe she believes what she's saying, and I believe that something has helped some of the people that she's giving this soap to.
I agree with you 100%. I could hear it in her voice. She certainly believes in her product. She certainly believes that she has seen these improvements. No question about it. Her science is all wrong. Her validation is all wrong. But it doesn't mean that she is wrong in believing what she's seeing. Does that make sense?
Yes, it does make sense. That's well said. And I think that she made it clear that she didn't try to slip the URL in or talk about her product. I would have deleted that anyway. And I appreciate her not doing that. So it definitely shows a level of sincerity. I believe that she believes in what she's saying.
There's a level of couth that was appreciated.
Yes.
How's that?
Yes.
That works.
That does work. All right. I had somebody here that's been holding on for a long time. It's from a 718 exchange.
Hang on.
I'm not sure if this is who I think it is.
Hang on.
But
it is 718. Hold on. Uh-oh.
But I will take the call before I take anybody else's because he's been holding on for a long time. Let's see who this is. Hey, man, you're on the air. Who's this, and where are you calling from?
Yes, it's me. I've recovered from my medical leave.
I didn't know you were on medical leave, Joe.
Well, people have falsely accused me of resigning from the Bald Truth, where I said I was submitting a medical leave due to my heart problem for a couple of weeks.
Oh, I don't. So are you saying that Dave Artista misread the email that you sent him to do an official resignation? So you're saying?
No, I did not resign from the Bald Truth. I took a medical leave.
So what you're saying, and let me get this straight. What you're saying is Dave Artista is a liar.
No, he misunderstood me. David, he's a dear friend of mine.
So how could he have misunderstood? He read an exact email from you.
But I forgot to leave out the medical leave part. I've been in a lot of stress. I had to go to the hospital due to heart problems.
Well, you left, and I'm glad that you're feeling better. Well, he may have left that out, but he didn't leave out the real hair loss show bit and some other stuff that you wrote.
No, I wrote that. You know why I wrote that? Having to do with my wife. I wrote you back about that.
No, I don't. Explain.
It was part of my situation. I knew my wife would be minded of the show, so I deliberately didn't call up because she'd be listening to me.
Oh.
I wrote you an email on that.
Yeah, you did. You did.
But I'm a man of many illusions.
You are. You certainly are, my man. You certainly are. But I will tell you this. And to be completely fair, like you said, and I wrote you back today. I think it's a great opportunity for us to kind of move the show in a more positive direction, which is what we're doing.
Positive. A lot of positive news.
And I will give you time like I give other callers, but that's it.
You give me as much as Margaret?
Well, maybe not as much as Margaret. Margaret was a special case, but I'll give you some time. So tell me what's going on.
First of all, I'm well, and thank you for caring and asking about me. I appreciate that, your email.
All right.
I appreciate that. You're my friend.
Good.
Forget what you might have heard. It's all nonsense. Obviously, I'm here, right? I'm alive. I could have passed away, but I didn't.
Well, I'm glad for that. So go ahead, man.
Okay. Go ahead. I'm sorry.
Go ahead. We got some other calls.
This is very important. The allergen news will be breaking within the next 2 weeks. For the first time in history, we will have a product that actually treats hair loss, which people should be amazed by.
We already have a product that treats hair loss.
214. What?
Yeah, we have we like Joe said, we do have a product that treats hair loss really well.
What is that?
Finasteride.
Finasteride.
Oh, well, a topical I'm talking about.
Okay.
I mean, this is going to be on the cover of Time magazine. This is such a fantastic, I don't know the results yet, but when it's taken over by activists, the largest pharmaceutical company in the world, for obvious reasons, 2 and 2 equals 4 in this case, but you're a smart man.
Well, all I can say is that, it's great that we're going to have another product in our arsenal. Let's hope that it is more effective than minoxidil. And if it is, it's going to give people the opportunity who either are afraid to use finasteride or have not done well on finasteride to have another option. And also, it may help to kickstart a hair growth on those who may have been on medications and plateaued. So it could be a great thing.
This is like a topical dutasteride or something?
No, basically it's biminoprost. It's basically what they use for like Latisse.
Yeah.
No, it's a PGD2 inhibitor.
Right, but basically, so it increases hair shaft diameter and obviously keeps hair in anagen phase longer.
Right,
and we know it works, but to what level it works on scalp hair, only time is going to tell.
Jury's still out.
Well, 2 weeks from now we'll know. Dr. Valerie Randall, the IHRS convention, is very, very positive on this new drug. Now, part 2. As you know, Spencer, my wife gifted me with a Therodome helmet to brown-nose me so I don't divorce her.
That's good.
I've been using it now. They recommend 3 times a week, so I'm going to follow the directions.
Can we have you Skype in with the helmet on at some point?
That's a possibility, yes.
Okay.
But we're wearing a facial mask.
You could wear your surgical mask with your helmet.
You've seen my surgical mask at Blog World, right?
I have, yes.
So, do you have a GIMP mask?
It's not a GIMP. It's not a GIMP mask.
It's not a GIMP.
No.
Sorry.
So listen, guys. It could be great news. It could be so-so news. I don't know. I don't have the inside information that people on the forums apparently have.
Okay.
According to their sick
But I am a little
surprised.
surprised. I am a little surprised that you're calling Artista a liar. I think that's disturbing me the most because he doesn't come across as someone who would make up stories.
That's what I'm taking away from this.
It's a misunderstanding, Spencer. That's all it is. Obviously, if I resigned as a close.
Well, what he read was, you said some pretty unappealing and quasi-nasty things in what he read. I mean, I was actually pretty shocked.
Well, Spencer, you know I am bipolar. I have mood swings. What can I tell you?
So you did say these things. You're a dear
friend of mine. You always remember a dear friend of mine.
So you did. So you did say these things, though.
No, some of them I said, yeah, I'm taking medical leave, resigning for a couple of weeks. I don't know. It's a misunderstanding, Spencer. That's all it is. It's really a non-issue. We should be excited about the monoprop.
Joe, first of all, I'm just giving you shit. I don't really care. I'm having a little fun.
How's a woman I'd sleep with you?
I don't want to hear that. I don't want to hear that, dude. I don't want to hear that.
Not a woman.
But this is what we're going to do. This is what we're going to do for 2015. There's going to be less Joe from Staten Island on the Bald Truth. If you want to call,
we had it for the last 6 months. Less Joe from Staten Island. I have a regular call. That's it.
There may be even less. But you are more than welcome to always be a part of the show. You're more than welcome to call in. I, of course, will take your calls. And if you have something that you really important to share and add to the show, I want to hear it.
Well, I think using the Therodome is very important. I'm experimenting with it. It's 10 times more as strong as the laser comb. It's 80 diodes, where the laser comb had 10 diodes in it.
Right, and I hope that it somehow helps you out. I know you still have a lot of donor hair. That could be miniaturizing. You have a lot of hair that's still in the back and the sides that you might be able to strengthen with the helmet. I don't know, and I think it's interesting that you're willing to try it.
Joe, are sorry, cut me off. Joe, are you using any sort of topical that's sold or recommended with the Therodome, or is it just the Therodome itself?
I habitually been using Rogaine for the last 5% for the last 10 years since it's been on the market.
Okay, but nothing. Okay, so the reason I ask is a lot of times these laser products will recommend that you take some sort of potion or lotion that they also sell, which happens to have minoxidil. Poof, you get the results, but you're already on it. So you have a baseline established already. So we can look forward to seeing some sort of result from the laser itself.
They told me to use Rogaine. They don't sell it. They said buy it at the store. To use it every other day, not to use it every day. Could you guys please explain to me why I shouldn't use it every day?
No,
Spencer?
I cannot. I would go by the instruction. I would go by the instructions of the manufacturer. And you know how I feel about low-level laser therapy for hair loss. And, I spoke to you about it in private and publicly. You wanted to initially try the laser cap, but I was able to get you a free laser cap, but you were not happy with what it would entail for you to get that cap, and the fact
those things are expensive.
Yeah, and the fact
$3,000.
And the fact that the physician wanted to take images and basically track your progress. You refused that. So, this was the next best thing, especially if you're going to pay for it. It's a lot less expensive.
Even the wholesale is
I do
expensive.
appreciate the doctor's offer, but you have to understand something. I refused, even Gary Hitzig wanted to photograph me, and I refused any photographs.
That's the way that it is. What are you going to do?
So I just bought this cap on my own, and I'll access my own, what's the word? Could you help me out here? Assess my own hair loss.
Yeah. Well,
Sorry, Joe, what'd you say, buddy?
Assess.
Assess my own hair loss.
Assess.
Well, you know what?
Yeah.
Let us know how you do. Keep us abreast of the situation.
I'll be honest, I won't BS you. You know that.
Yeah, and I'm glad. It's a company that we have nothing to do with. It's actually better that you didn't get it from Alan Bauman, that you're not having him track or assess your results. You can do it yourself. It's going to be anecdotal, of course. You're not going to have any images, but you can tell if there's anything positive going on with your hair.
I'll know. So a brief thing. When you speak to Alan, tell him I'm willing to buy his 82M supplement with this, but I can't see to get it.
No,
hey, Joe,
I want to pay for it.
You tell him yourself, I am not here to sell any products or services for Alan Bauman or anybody else.
I know
Joe,
that, Spencer. You're great. Yes, Joe.
Joe, I want to tell you, I want to stress to you that if you're going to give this Theradome a legitimate effort, do not change your routine at all in even the slightest way. Your Rogaine use, if you're taking it every day, do not stop taking it every day. If you're taking it every other day already, do not stop taking it every other day. Change nothing and let the laser cap or the Theradome be the only change in your routine, as that's the only way you can gauge its effectiveness.
Well, I do take Rogaine twice a day. I did take Propecia for 3 years. It did nothing for me, but I had no side effects at all. So I think, actually, only side effect I had was very sexually aroused, shall we say.
Well, that does happen.
Okay.
That does happen. Joe, listen, good to hear from you. I'm glad you're well. You sound very lucid tonight. I hope when you keep calling in, I hope you stay sober like you are, because you sound really good.
And one more thing, let me apologize for this phone number. I couldn't use my cell phone because it's not working down here where I am in my new bedroom downstairs. So I have to use the house phone.
Well, I think it's fine. It's a very clear connection.
Yeah, but you didn't recognize the number. That's what hurts.
Why does it hurt?
Because
I saw it as 718 and I still took it anyway. Because I thought it might be you.
2 and 2 together. You're a smart man. I love you, man. You know that, man.
All right, dude. Joe from Staten Island, everybody. Take care, Joe.
You a get mensch, man.
All right. Thank you.
See you, Joe.
Bye-bye.
Good night, Joe.
888-659-3727. Hey, man, you're on the air. Who's this and where are you calling from?
Hey, Spencer. This is Vic from D.C.
Hey, Vic, man. What's happening?
Vic.
How are you?
Hey, good. Hey, it's nice to see both the Joes on there tonight. The hair loss expert and...
Yeah, Joe wrote me. He wrote me an email saying that it was all a big misunderstanding and that he hasn't resigned from the Bald Truth. I'm just like, dude, whatever, man. It's not like you work for the Bald Truth. You want to call in, you call in.
Yeah.
For crying out loud.
Well, yeah, I thought I did listen to the episode where I think his friend Artista read an email, and I think the human being Joe from Staten Island, I think he's a good human being, and I do
absolutely
think that,
no question.
I do think that he, has probably been through a lot in terms of just psychological damage of hair loss, and
sure.
So it's very kind of you, Spencer, help him for so many years. I really don't think there's too many people that would have done what you did in terms of, in terms of the longevity of how much time you gave him. So,
well, I appreciate you saying that.
Oh, you're welcome, man. You know, I'm glad that he's back. I'm glad it was just a misunderstanding, and I'm glad that he's still friends with you and Artista. It's nice to have him back. You know?
I don't think it was a misunderstanding. I think that he just lost his fucking mind for a couple of weeks, and he wants to come back. But I'm fine with that.
Yeah. Well,
no misunderstanding. For that point in time, he thought I was a motherfucker for whatever reason, because things didn't go his way. And then he thought about it after he got off his meds or got on his meds or whatever, and now he wants to be back. I never had a problem with it either way.
Well, it's still very compassionate of you to help him for as long as you have. But anyway, I'm getting off topic. I'm just tuning in tonight because I haven't. I just got off work, so I haven't.
By the way, you never. I don't know if you ever told us what you did. Are you able to say that on the air? You don't have to.
For work?
For work, yeah.
Oh, sure, yeah, no problem. I actually worked downtown D.C. for the Washington Wizards. I just do it's like floor maintenance and stuff.
That's very cool.
That's cool.
I wouldn't call it a janitor exactly, but they have to put up logos and stuff on the floor.
Yeah, that's very cool.
So I appreciate that.
That's a skill. That's not. I'm not saying there's anything wrong with any janitors out there. I mean, we need janitors in this world, but what you do is a little beyond that. It takes some skill, and you have to be trained to do that, and it's a very unique job.
I appreciate that. But let's see. So
you can get me tickets to the games.
I was going to say.
Oh, you got it. I mean,
can you get me floor? You can get me floor seats.
I could probably get you 2 seats for you in common law.
But can you get me floor seats on the floor?
On the floor.
Yeah.
Oh, I thought you said 4 seats. 4 seats. Floor seats. You know what? If I pull my strings, hopefully, no more than 3 rows back.
Well, then maybe forget about common law. Maybe I'll take Joe Tillman.
Oh, that'd be awesome.
2 seats on the floor are fine.
Awesome. Yeah, you can get 3 seats, 1 for you.
Yeah, there you go. Exactly.
I'd probably be working, but I appreciate that. But let's see. So basically, I called in tonight because I just wanted to. I didn't wish you Happy New Year. I wanted to do that.
Oh, thank you.
Same to you. And also same to Joe Tronic.
Thank you.
And
thank you very much.
And the other thing that was really interesting was you guys were talking about the evolution of FUE, and one thing that I find very interesting is that a lot of the posts on the forum are a lot of the members you have on your website are now starting to trust robotic hair transplantation. And my question for you tonight, for both you and Joe Tronic, is do you think that at some point we are going to, this is kind of I guess it's a weird question, but at some point, do you see there being technology in terms of it being so good that, in terms of hair multiplication, it being so good that actual transplants completely fade away? And if so, do you think it would be like 10 years, 15 year, or what are your thoughts on that? Because
all right,
honestly,
go ahead.
Yeah.
Well, you know what? Finish your thought, and then I'll go on.
Sure. I honestly think that there's always going to be surgeons on this earth who are going to do transplantation because it's been around for so long. But do you think that at some point there's, like, for example, you've had so many intelligent gentlemen come to your show. One who's Dr. Wesley. He's Pilofocus.
Yeah, the Pilofocus. Yeah.
Pilia Focus, then you have Dr. Go, then you have the guy in India who's doing that stuff. So, in your expert opinion, do you think, and both of your expert opinions, do you in the future, do you see there being hope for a guy who's like a Norwood 6 or 7, just like if they don't have enough donor or they're thinning donor, or and the guy just wants to have like a thin Norwood 3? Do you see that being a possibility?
Well, I think as far as there's a couple of questions that I sense are in there. One is, do we think there's going to be eventually unlimited donor, and that hair multiplication or hair neogenesis or hair doubling or whatever they're going to call it, is that ever going to be a reality? I believe that it will be a reality at some point. I also believe that robotics are going to be involved in that reality, as far as being able to either inject or implant or create recipient areas and implant duplicated hairs once these technologies come to fruition. So I think it's going to be a combination of these technologies and robotics that's going to make it something that's going to be really able to reach critical mass. So I think it will happen. As far as, do I think there's still going to be hair transplant surgeons around? There will only be hair transplant surgeons around as long as hair transplantation is needed. So if the technology is just being able to multiply or duplicate donor hair that then has to be implanted, then yes, hair transplant surgeons as we know them will still be around. If the technology turns into basically just injecting, cells, having a cellular therapy, then they're not going to be called hair transplant surgeons anymore, but they're still going to be, physicians who are going to be involved in the process that are going to be in the hair world. That's the best answer I can give you. What do you think, Joe?
I think that in the distant future, when I say distant, I mean beyond 10, 15 years from now, 20 years, and that is distant in the world of hair restoration and cosmetic surgery in general. I think that what we're going to see is an evolution further into robotic hair restoration, but I think after that we're going to see an evolution away from any surgery because of the power of biotech.
Okay.
And what I mean by that is, and this might address both questions, is that
eventually... Is this going to be before or after I can get like a real sex doll, like a sex robot?
Well, see, now that's a whole different discussion, but I think it'll be after the fact.
All right.
So don't worry about that. But
good.
No, I think that biotech will allow us to have hairs grown, cultured, however they're going to wind up doing it, and this will put the hair transplant surgeon specialty out of business. And the reason being is because if you can send 100 hairs to a lab to be cloned into 100,000 hairs, then there will be so many people that have access to this technology eventually that it'll become a commodity, and you'll have anyone and everyone that has access to a lab selling this service. So it'll be your dermatologist, it'll be your plastic surgeon.
Right, but if you're actually going to be multiplying hairs, like you just said, someone who's going to have to implant those hairs. So there will be some surgical involvement, maybe not extraction or large scale extraction, but definitely surgical involvement as far as creating recipient sites and placing those newly generated hairs, if that's what you're talking about.
It is, but I don't think it'll be a specialty anymore. I think that the specialists will be gone.
The specialists are going to be gone soon anyway.
Yeah.
Within 5 years, I believe that the industry is going to be completely different. There's no doubt in my mind that robotics is going to change everything. So the guys that are holding on to this specialty for dear life, these are the guys, in my view, who need to get involved with robotics as soon as possible, so that they're still looked at as the real, leaders in the field.
Yeah.
When these other guys who are going to be entering the field get their hands on these machines, so at least they'll have another decade to, continue to lead the field. But that's it. Then it's going to be game over.
Yeah. If they can't cement themselves now as pioneers and leaders of the coming technology, then they'll just be lost in the wash with everyone else.
Let's put it this way. Company that you worked for a long time is now moving in that direction. Yeah. And there's a reason for that. There is no way in hell that Victor Hassan or Jerry Wong would commit to something like this unless they truly believed that it has evolved to the point where they're going to help patients. That's what I believe.
Yeah.
So, I mean, I think that speaks volumes for the evolution of this field.
Vic, did I answer your questions, or was there anything I left out?
Oh no, that was great. I mean, the reason I wanted both of your opinions is, well, you know, I wanted to get as many views as I could because, you know, while I have moved on completely and I'm at a great place, you know, what guy at the very corner of his mind, what guy still doesn't have a small bit of hope to get his hair back? Now, I'm at a healthy place. Spencer has helped me get to a very healthy mind state, and, you know, that's priceless. But every guy, I guess, at the back of his mind it's gonna, you know, like think that it would be nice to get a little.
Of course, listen, I'm still hoping and praying for like actual penis enlargement, which doesn't exist. These guys they're throwing in fat and giving you pumps and all that stuff, and these poor guys are just being ripped off left and right, in my view. So, anyway, I guess that's my issue. But listen, Vic, man, it's always a pleasure when you call in. You are such a kind soul and respectful, and I really appreciate you taking the time to call the show.
Well, thank you. Can I just say one last thing?
Yes.
That's it. And then this is to Joe from Staten Island. Joe, listen, man, you've been a long-time caller, and one thing you should just know is you'll never find a person like Spencer who's just who gives you airtime for as long as he did. So please, you know, just next time something like this happens, don't go through a medium. That way you won't get misunderstood. Go directly to the source, okay? We all love you, Joe, from Staten Island. You know, Happy New Year to you. And then, you know, hopefully things work out for you. Thanks, Spencer.
Vic, well said. Happy New Year.
Said.
Take care. Guys, we're gonna end the show on that high note. I'm not going to take any more calls because you just never know what you're going to get. And, you know, I was thinking about actually getting a screener this year, but it does take some of the fun and I mean, let's put it this way. If we would have had a screener, Margaret would never have gotten on. And part of me enjoyed that call because I think it's important that people hear that stuff is still going on. And I think she was very sincere. So, but if I had a screener, she never would have gotten on. How do you feel about that? You think it would have been better if she didn't get on?
No, I'm glad that she did, and I agree because if you start having screeners, then it kind of takes away what separates the show from
everything else.
Yeah,
but then Joe would never get back on.
Okay, let's re-examine this. No, I'm just kidding. I'm joking. No, I think you should keep it more of an open format. I like the uncertainty and the potential for surprise.
Well, I can tell you, most radio hosts would never ever do on-screen calls. There's a couple of guys that kind of do it as a gimmick once in a while, maybe once a week or once every month. But it is not an easy thing to do. Not only to run everything that I run and to take my own calls, but you just never know what you're going to get. Never know what you're going to get. And sometimes it could be ugly. But, you know, we have some really respectful callers for the most part, and I appreciate the open format, so we'll keep it this way. Joe Tillman, thank you so much for hanging out. As usual, you sounded great through Skype tonight. And I hope that the next time I have you on, I will be able to get your video through this second machine, because we need two Skype machines to make this show work. Get your video so that we could have a side-by-side instead of just having your voice. Even though you have a great voice,
thank you.
I'm sure people would like to see your studio.
Well, it's ready to go when you are, so yeah, we'll get that set up soon.
All right, and actually, I just put up a clip of me and Joe in Joe's Bald Truth North Studios. Yeah, looks kind of similar to the Bald Truth Studios. You did a really good job with it.
Thank you.
And I actually got some commentary on the segment that we put up.
Already
from a doctor, actually.
Really?
Yeah, who is unfortunately not very happy. But I will say that if he's listening right now, dude, do you really think that I would be speaking about you? You know, after all of the years that we've been working together. I mean, Jesus Christ. Anyway, guys, thanks so much.
I hope someone got that.
Yeah, I think some people may have.
Some people probably do.
He's probably listening. All right, dude, listen, thanks so much. And we will talk to you soon.
All right, take care.
All right, man, take
Good night,
it
guys.
easy. Guys, let me give out the websites. If you want to check out the American Hair Loss Association, go to AmericanHairLoss.org. To check out archive broadcasts of this show, you can check out thebaldtruth.com. Do me a favor, check out The Bald Truth. I am noticing that, and this is fine, but a lot of people are viewing. You could also check it on GFQ, but a lot of people are viewing it on other resources. And, we kind of want to keep it in-house. So, try to check out when you can. Check out the broadcast, the archives on thebaldtruth.com or on GFQ or guysfromqueens.com. That would be great. And you know what? If you want to help out the guys from Queens, the guys that syndicate this program, I do not make $1 from this. So I'm just going to say, check out their Amazon link. If you're going to buy something through Amazon.com, go to their website, click on their Amazon link, and do your shopping through GFQ, because you can definitely help those guys out. They're doing a great job. If you want to interact with other hair loss sufferers, you can go to our message forum, which is baldtruthtalk.com. Remember, please take everything that you read on message forums with a grain of salt. Especially if you don't know where it's coming from. If it's coming from an expert, a physician, a known entity in the field, that's a different story. But if it's coming from an anonymous user, you can learn from anonymous users. I'm not saying you can't. You can interact with other people who have had experiences, but unless they're willing to kind of say who they are, just be careful. You never know where the information is coming from. I want you guys to have a great week. Until next time, be strong, God bless, and thank you so much for listening.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the program, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you. Good night.